Thousands of Wisconsinites are rolling up their sleeves, eager to get a COVID-19 vaccine. But others are saying, no thanks. Fox 6 investigator Brian Polson shows you why some of the state's highest priority recipients are refusing to get a shot and how that could impact the end of the pandemic.
Until now, there have been far more people who say they want a vaccine than there are available doses. So not much attention has been paid to those who've been offered a vaccination but declined. We've compiled vaccine refusal data for 5 of the largest cities in southeastern Wisconsin, including the one city that says it stopped tracking those vaccination rates altogether.
Saving lives! Saving lives!
The fastest vaccines ever developed.
Here we go.
Have millions of Americans lining up.
Didn't feel a thing.
For their shot at history.
This is like historic.
It's patriotic. I'm in. Get this junk over with.
For some, the life-saving serum might as well be liquid gold, but for others,
I'm nervous about it.
The scientific promise that the injections are safe and effective,
I just don't trust it,
is not enough.
Honestly, the biggest thing is you can't trust the media. I know you guys are media.
Doug Myers is a volunteer firefighter in Wind Lake.
Oh, good toss.
He says he may get the shot eventually, but for now, he's unsure.
I feel like almost just getting COVID is not as bad as maybe getting the shot.
It's almost catch-22.
Shane Ryan is a veteran with a compromised immune system, but also serious concerns about an allergic reaction.
Feels like you can't win.
Yeah, it really does.
Others tell Fox 6 the whole thing is a government conspiracy, or they object to the use of cell lines derived from aborted fetuses in vaccine development. But by far the most common concern is that the vaccines are simply too new.
We just don't know what's going to happen in the long term.
Whatever the reasons, the president's chief medical advisor, Dr. Anthony Fauci, says reluctance to get a shot could prolong the time it takes for the country to reach so-called herd immunity.
We don't know what that number is.
That's the point at which so many people are immune that the virus runs out of hosts and stops spreading.
If a significant number of people do not get vaccinated, then that would delay where we would get to that endpoint.
Last week, Dr. Fauci estimated that 70 to 85% of Americans need to be fully vaccinated to end the pandemic. In Wisconsin, health officials say we're just over 13%. But at least they know how many people have been injected.
I got my shot, everybody.
What they do not know is how many have been offered a shot but declined.
Is DHS actively tracking some of that feedback?
Yeah, no, that isn't something that we've built into our data collection system at this point in time.
So the Fox 6 investigators set out to do what state officials have not: measure the magnitude of vaccine hesitancy.
It's an issue that's been generations in the making.
Hospitals and long-term care facilities are not subject to public records laws, so we focused our investigation on another top priority group.
This is a super safe vaccine.
First responders.
Let's stop people from dying from this.
We asked police and fire departments in the 5 largest cities in southeastern Wisconsin for vaccination records with personal information removed. 7 of the 10 departments responded, 6 with enough data to paint a picture.
We were the first fire department in the state to put needles in arms.
Nick Ashman is EMS division chief for the Kenosha Fire Department.
I think it's the right thing to do.
Which has already inoculated more than 88% of its firefighters, EMTs, and paramedics.
I'm proud of our union. I'm proud of our leadership, our city leadership for supporting it. Yeah, it's a great accomplishment.
But even in Kenosha, 12% of firefighters declined.
The second you change your mind, come see me and I'll get you a shot.
At the West Allis Fire Department, the refusal rate is 13%. Waukesha Fire, 34%. Racine Fire, 41%. And both West Allis Police and the Milwaukee Fire Department, roughly 50%.
Everybody's concerns really are different, and you have to be respectful of that.
Assistant Milwaukee Fire Chief Joshua Parrish says that 50% figure is probably outdated by now. They stopped counting altogether last month after the city attorney raised privacy concerns. But in spite of the department's efforts to educate members about the vaccine, Parrish says some just aren't buying in.
Even if you deliver a message that is wholly accurate, it does not mean that the recipient will necessarily believe that message.
Some of that, he says, is typical anti-vax sentiment that predates the pandemic.
A lot of the general conspiracy theories, that stuff still exists.
Others have specific medical questions he can't answer.
Those are medical, items that exist in their sphere. That really is their jam, and we don't want to cross that line.
But there's another concern that is especially prevalent in an urban fire department.
There is a history of disparate treatment.
I'm never going to get it.
Marie Manning summed it up with one word: Tuskegee.
The healthcare system in and of itself hasn't been really kind to my people.
Manning works in healthcare, but says the federal government's infamous Tuskegee Experiment is one of the main reasons she does not want the COVID-19 vaccine.
I don't necessarily trust the agenda here.
In 1932, the U.S. government commissioned a study of African American men with syphilis. The men were told they were getting free health care, but they weren't. Instead, the government watched for 40 years as many of the participants died of untreated disease, even after penicillin had been invented.
It's a complicated history, but it's there.
Assistant Chief Parrish says that history is just one of the roadblocks he faces in encouraging some Milwaukee firefighters to shoulder up.
How concerned are you that half of the fire department is still going out and doing this job without the protection of a vaccination?
That's a great question.
Parrish says firefighters are already protected by N95 masks and other personal protective gear.
This represents a great example.
But Eshman says it's about more than protecting their own personnel.
It's what we need to do to move forward.
It's about sending a message to everyone else.
It's safe for us. It'll be safe for you.
All 5 of the fire departments that we sent requests to, including Milwaukee, responded with at least some level of vaccine tracking data, but only 2 police departments did, West Allis and Racine. Though Racine's data was so heavily redacted, we really couldn't get much out of it. 3 other police departments, Milwaukee, Waukesha, and Kenosha, have yet to respond to our requests, which were sent in February with a follow-up earlier this month. In Milwaukee, Brian Polson, Fox 6 Investigators.